Welcome back to the Lost Book of Herbal Remedies. I'm Emma, and today we've got a really fascinating topic to explore: recent breakthroughs in bipolar disorder research. This is a topic that affects millions of people worldwide, and new discoveries are shedding light on more effective ways to manage and treat the condition.
Bipolar disorder, as many of you know, is a chronic psychiatric condition characterized by extreme mood swings from manic highs to depressive lows. It's a complex disorder, and the more we learn about it, the more we realize how intricate the treatment and management really need to be.
Exactly, Alex. Today, we're going to take you through everything from the long-term effects of lithium therapy, which has been a cornerstone of bipolar disorder treatment for decades, to the role of cutting-edge diagnostic tools like machine learning and neuroimaging. We'll also dive into some of the exciting research on nutraceuticals, bioactive compounds found in foods like omega-3 fatty acids and probiotics, and how they could play a role in future treatments.
But let's start with lithium therapy because, as you said, it's been around for a long time and is still considered one of the most effective treatments for bipolar disorder. However, recent research is raising concerns about its long-term effects on kidney health.
Lithium has been incredibly effective in stabilizing mood and preventing both manic and depressive episodes. But a recent study found that about 15% of patients who had been on lithium for over 6 years developed chronic kidney disease, or CKD. That's a significant number, and it really underscores the importance of regular kidney function monitoring for patients on lithium therapy.
That's an important point, Emma. The study showed that patients who developed CKD had been on lithium for an average of 6.6 years, compared to those without CKD who had been on lithium for about 4.5 years. This suggests that the duration of lithium use plays a critical role in the risk of kidney dysfunction, especially in patients who already have risk factors like hypertension.
Exactly. And what's even more concerning is that discontinuing lithium after a CKD diagnosis didn't improve kidney function. So it's not just a matter of stopping the medication once the damage is done. Clinicians really need to weigh the benefits of mood stabilization against the potential long-term risks to kidney health.
That's where personalized treatment plans come into play. By carefully assessing the patient's risk factors, like age and pre-existing conditions, healthcare providers can make more informed decisions about how long to keep someone on lithium and what other treatments might be more appropriate.
Speaking of personalized treatments, let's shift gears to one of the most exciting areas of recent research: diagnostic innovations using machine learning and neuroimaging. Traditional bipolar disorder diagnoses often rely on clinical assessments, which can be subjective and prone to error. But with machine learning, we're starting to see a real breakthrough in diagnostic accuracy.
Absolutely. A study using multiple types of brain imaging, like MRI, found that machine learning algorithms could accurately classify individuals with bipolar disorder with an accuracy rate of 89.5%. That's remarkable. The study identified key brain regions, including the cerebellum and parts of the emotional control network, that play a role in distinguishing bipolar disorder from other psychiatric conditions.
It's fascinating how technology is evolving in this field. By integrating data from structural, functional, and diffusion-weighted imaging, researchers are able to create a more complete picture of the neural alterations associated with bipolar disorder. This could reduce the risk of misdiagnosis, which is a big issue in mental health.
Exactly. And while these findings are promising, there's still a challenge in generalizing the results across diverse populations and clinical settings. But we're definitely moving in the right direction, and it's exciting to think about where this could lead in terms of more accurate, personalized care for people with bipolar disorder.
Right. Another area where we're seeing significant advancements is in understanding the genetic factors that contribute to bipolar disorder. A recent study found links between specific gene variants, ADAR2A and AVPR1B, and stress-related bipolar disorder.
Yes, and what's really interesting is how these gene variants interact with environmental stressors. The study found that individuals with the AC genotype of ADAR2A were at an increased risk of developing bipolar disorder after experiencing stress. On the other hand, the CT genotype of AVPR1B seemed to offer some protection against stress-induced episodes.
It really highlights the complexity of bipolar disorder, doesn't it? The interplay between genetics and environment is so crucial in understanding who's at risk and how we can tailor treatments. By identifying people at higher risk for stress-induced episodes, clinicians can intervene earlier and possibly prevent severe mood episodes.
And it's not just genetics or diagnostic tools that are advancing. Let's talk about something that affects nearly everyone with bipolar disorder: sleep disorders, particularly insomnia. Insomnia can make mood instability worse and really affect someone's overall functioning.
Absolutely. Recent reviews have looked at dual orexin receptor antagonists, or DORAs, as a treatment for insomnia in psychiatric disorders like bipolar disorder. These medications have been shown to improve sleep quality without worsening psychiatric's big deal. Addressing insomnia can significantly enhance a person's quality of life and may reduce the risk of future mood episodes.
It's really a promising area of research, but as with many new treatments, more long-term studies are needed to assess the safety and efficacy of these drugs in people with bipolar disorder. But the potential is definitely there.
And that brings us to one of the most exciting areas of research: nutraceuticals. These are bioactive compounds found in foods and dietary supplements, and they're showing great promise in the management of psychiatric disorders like bipolar disorder. Omega-3 fatty acids in particular have gained a lot of attention.
Yes, omega-3s, especially EPA and DHA, are known for their anti-inflammatory properties and their role in maintaining neuronal health. Studies have shown that people with bipolar disorder often have imbalances in omega-3 and omega-6 fatty acid ratios, and supplementation with omega-3s has been linked to reductions in depressive symptoms and mood swings.
And that's not all. Probiotics are also making waves in the mental health world. The gut-brain axis is a critical area of research, and probiotics have been shown to influence mood regulation by modulating gut microbiota. Some studies even suggest that probiotics can help reduce rehospitalization rates in people recovering from manic episodes.
That's amazing. By addressing gut health, we may be able to help stabilize mood and improve overall treatment outcomes for people with bipolar disorder. It's another example of how a holistic approach to health, considering both the body and the mind, can be so effective.
Exactly. And that's a perfect segue into the herbal formula from the Lost Book of Herbal Remedies, which we'll cover in depth. This formula is designed specifically to address mood stabilization, neuroinflammation, and gut-brain axis modulation, all critical aspects of bipolar disorder management.
Yes, the core components of this formula include omega-3 fatty acids for balancing the essential fatty acids in the body and reducing neuroinflammation, and a probiotic complex that supports gut health. It also includes some really powerful herbs like St. John's wort, which has antidepressant properties, and rhodiola rosea, which helps improve stress resilience.
Ashwagandha is another key herb in this formula, known for its neuroprotective and stress-modulating effects. And then there's saffron, which has been shown to be effective in treating mild to moderate depression, making it especially helpful during depressive phases of bipolar disorder.
In addition to the herbs, the formula incorporates magnesium, which supports neuronal function, vitamin D to address deficiencies often seen in people with mood disorders, and coenzyme Q10, an antioxidant that supports mitochondrial function and overall brain health.
It's important to note that while this herbal formula can be incredibly supportive, it should always be used in consultation with a healthcare provider, especially when medications like St. John's wort are involved, as they can interact with other treatments.
Exactly. This formula is designed to be personalized, taking into account each individual's specific needs and current treatment regimen. Regular monitoring, especially for patients on long-term lithium therapy, is also crucial to ensure the best outcomes.
So to wrap up, we're seeing a real shift toward a more comprehensive and holistic approach to managing bipolar disorder. From lithium monitoring to diagnostic innovations, genetic insights, and the integration of nutraceuticals and herbal remedies, there's a lot of exciting potential for improving treatment outcomes.
Absolutely. The future of bipolar disorder treatment looks promising, and it's encouraging to see how these various approaches are being combined to offer more personalized, effective care.
If you want to explore any of these topics in more detail or check out the full herbal formula, head over to herbalbloom.org, where we've posted the complete article. You'll find all the information we covered today and more.
Thanks for tuning in to the Lost Book of Herbal Remedies. Don't forget to subscribe so you never miss an episode on the latest breakthroughs in health and wellness.
Take care, stay healthy, and we'll see you next time.